Polychoria is a congenital disease in which there is not one pupil in the iris, but several types of polychory. First of all, polychory can be one-sided or two-sided. Polychoria also varies in the number of pupillary openings. Most often there are 2 or 3 pupillary openings. In addition, true polychory and pseudo-polychory, false polychory, are distinguished. True polychory is rare enough. With true polychoria, each pupil opening has its own sphincter, which can respond to light or contract as a result of other causes. The mechanism of development of true polychory is not fully known. A possible cause is the seizure or separation of the pupil region during embryonic development. It was also suggested that the true polychoria develops as a result of the partial closure of the coloboma with ectoderm and mesoderm. The third option is that the residual adhesion of the lens to the cornea after separation of the mesoderm and ectoderm could lead to the formation of the so-called bridge through this area during the formation of the anterior chamber. Several pupillary holes surrounded by muscle fibers formed in the result. The theory was also advanced that polychoria developed at an early stage, when neuroectoderm cells were still polypotent and, as a result of exposure to unfavorable factors, differentiated into muscle fibers. False polychory, pseudo-polychory, is characterized by the fact that the iris has several holes, but they do not have their own sphincters, that is, they are not actually pupils. The cause of pseudopolychoria is progressive chordectopia or hypoplasia of the iris, as well as trauma, surgery, or pupillary membranes. Symptoms and diagnosis of polychory. The diagnosis of polychoria and pseudopolychoria is made upon examination of the patient based on the detection of several pupillary openings. With true polychoria, extra pupils, as a rule, are at some distance from the main. All pupils will respond to light and expand when instilled mydriatics. With sufficiently wide pupils, the patient's vision can remain good, but if the pupil diameter is less than 1.5 mm, especially the main pupil, then there is a decrease in visual acuity. There is a linear relationship: the smaller the pupil, the less visual acuity. Visual acuity cannot be corrected, and in such patients there is a risk of developing amblyopia, pseudopolychoria and other diseases. As a rule, pseudopolychory occurs in the framework of other diseases and syndromes.